Hello, everyone. Welcome and thank you for joining us for our December episode of Chang Reaction. I am Taylor Young and I am the Assistant Director of the National Keratoconus Foundation. We are a patient advocacy program based in Southern California at the University of California, Irvine. NKCF provides information to patients and their families and raises public awareness of this cornea disease. We invite you to visit our website, nkcf.org, and sign up for our newsletter and register for our bi-monthly webinars. We also post news on our Instagram, Facebook, and LinkedIn social media pages. This is episode 21 of Chang Reaction, our Ask the Expert podcast. Our partner is Dr. Clark Chang, a noted keratoconus expert and friend of NKCF. We often receive questions about life with keratoconus, and Dr. Chang is here to help us answer your questions. You can view past episodes by going to nkcf.org/webinars. Dr. Chang is currently the Director of Specialty Contact Lenses on the Cornea Service at Wills Eye Hospital in Philadelphia. He is also a member of the medical affairs team at Glaukos, the company that makes the FDA-approved crosslinking product and equipment. He is a graduate of the Pennsylvania College of Optometry and a fellow of the American Academy of Optometry. Dr. Chang was also named the NKCF Top Doc in 2020. Hi, Dr. Chang.
Hi, Taylor. Hi, everybody out there. Thanks for joining us. I cannot believe it's the end of 2022 already. Are you ready for the holidays?
I am. I'm ready to go spend some time with my family, but it definitely came quick.
I know. I'm glad that you and I both are, dressed in. This explains my getup because I'm, trying to wear something more festive for us to get ready for the holidays. So I'm really glad that we've spent a whole productive and great year for Chang Reaction, and hopefully everybody out there feels the same. So continue to listen and send us questions, as Taylor and I love to address those questions.
Yes. Well, let's just dive right in. Okay, so our first question comes from Jose in Arizona. Jose says he has poor vision in both eyes due to keratoconus. He has had crosslinking in both of his eyes, but he says his vision is still fluctuating. And so he is asking, when will his vision stabilize and improve?
Right. Hi, Jose. Thank you for sharing your experience with us and sending your questions. I would say that since 2016, since you're from Arizona, and we do have international listeners as well. So this question is perhaps is very interesting, but I do want to make a disclaimer, and that is in US since 2016, there continues to be only one FDA-approved corneal cross-linking treatment option to date. So this question is relevant, at least more relevant for progressive keratoconus patients in the United States, as more and more patients are being offered this approved treatment option. But it is worth noting, here's the disclaimer, it's worth noting that corneal cross-linking has been performed outside the US for many more years. And therefore, outside the US, there are different cross-linking treatment methods available, which tend to also have less standardization in the methodologies in which cross-linking are provided outside the US. And the reason I'm saying that is because the clinical info that I'm sharing, because since you're from Arizona, the information that I'm going to share and tailor to your question is more applicable to the standardized Dresden protocol for cross-linking treatment that is an epithelium off or epi-off corneal cross-linking methodology that is approved by FDA. So I do want to make that disclaimer. But going back to your question, the primary treatment goal for cross-linking is to stop or slow keratoconic progression instead of providing visual improvements. So in other words, vision may not improve after cross-linking when you compare your vision before and after. And that's the reason why, in my mind, it is important to consult with your eye doctors on whether FDA-approved cross-linking is right for you at earlier stages of keratoconus when the disease progression is first documented. But the other part of the question, though, is is more predictable, and that is when would your vision stabilize? Because every surgery, right, and that goes beyond eye surgeries, but any type of surgery comes with a recovery period, right? And so on your eye, you tend to notice your after a corneal surgery that your vision will fluctuate for a while, and then eventually, I suppose we could say, improve closer to the intended level, or where in this case, for corneal cross-linking, closer to returning you to the baseline, because we want to stabilize, right? So after epi-off cross-linking, using the conventional Dresden protocol, FDA approved, it is generally observed that it'll take at least 3 months after the cross-linking treatment before vision stabilizes or gets back closer to the preoperative baseline. But this process may take longer than 3 months in some patients, especially because two eyes are often treated at different times. And so the cumulative recovery periods seem a little longer because most people don't think about each eye. They think how they overall recover together, right? And this is especially true for those patients who rely solely on glasses for visual improvement. Why do I say that? Because contact lenses offer better optics. So compared to glasses for the better optics for majority of the keratoconus patient compared to their glasses, I should rephrase. And so therefore, contact lenses will help patients start seeing better after cross-linking when patients are cleared by their eye doctors to go back to wearing their contact lenses or to be fit with new contact lenses. And therefore, that 3 months period of time or 3+ months may not apply, because most often in my personal clinical experiences, I find that most patients, although they continue to fluctuate in their glasses for that first, say, 3-4 months, I can, as long as their recovery period on the surface of the eye, the corneal recovery looks good, they often can get back to wearing their contact lenses sooner, or be fit with new lenses at about 3 to 4 weeks after their treatment, which means that they're not waiting for that long period of time, such as 3 months, before they start seeing better or feel like their vision stabilizes. So it may be a difference depending on if you're relying on your glasses or wearing your contact lenses. So I hope that helps you, Jose. And if not, if I didn't answer some elements of your question, feel free to write in follow-up questions and I'll continue to answer them for you.
I think that's a great point. I think a lot of patients are hopeful that cross-linking will improve their vision, but I think that's a very common misconception. It just stabilizes the disease, which is very important. And then, like you said, contact lenses or glasses in some situations are what can help improve the vision afterwards.
Right. And that's not to say that Taylor, that's not to say that no one has reported improved vision after their treatment, right? It does happen, but it's not something that we can predict, and it certainly isn't the treatment goal. Is the reason that we wanted to make sure that we're clear on what exactly we're doing with cross-linking.
Right, exactly. Okay, well, our second question is from Denise from Maryland, and she says that she uses piggyback lenses, but her eyes still feel very dry. What can she do?
Right. Hello, Denise. So sorry that you're still struggling with your, contact lens wear after your most recent adjustment. But the good news is that there has been much advancements in contact lens technologies in recent years. So my advice is please don't give up trying to find what fits you the best or better, and definitely continue to consult with your own contact lens specialist on what other lens customizations can be tried in your situation. But you wrote your question, so let me try to answer the best I can with the limited information that I have. So let me start by saying that dry eye disease itself can certainly reduce contact lens wear comfort, and at the same time, a contact lens that is not well tolerated by the eye can also produce generalized symptoms similar to ocular dryness, and among many other symptoms or things. So it may be that one or both of these aspects needs to be addressed. And it often leads to confusion because our eyes have limited feedbacks for you to report what's happening, right? Either something's happening, you may feel discomfort or pain, or the eye may turn red to give you a warning, but that's not always a sign of, say, infection, or it could be many other things. So because of the limited feedback, that it tends to produce confusion when people feel like, well, I feel dry, and they think it's either their eyes are dry, they're not sure, they're not certain, or not, they don't understand that it can also be related to the lens material, lens design itself. So based on the question, the way that you asked your question, I assume that you had started wearing your corneal GP or RGP lenses before transitioning to piggyback lenses, despite the fact that after that transition, you still feel dry. And for those listeners who may have forgotten what piggyback lenses is, or are, they basically, you have a hard lens or corneal GP lens sitting on top of a soft lens while both lenses are being worn on the eye at the same time. And we did actually have a prior episode that covered different lens designs for keratoconus patients, so feel free to look that up. But Denise, getting back to your question, because the soft lens carrier is acting like a cushion between the gas permeable lens and your cornea, as you already know, they tend to feel more comfortable together rather than just the gas permeable lens by itself. However, depending on the exact fit or design of the soft lens carrier that is sitting next to your cornea, and how well that the top gas permeable lens or GP lens is being stabilized over that soft lens carrier, that's two things, right? The soft lens design, how well are they fitting together, both of them. And the third thing, the lens material, whether soft lens or gas permeable lens, may also not be the most synergistic with your tear film or your tear molecule. So because of that, your cornea could still be overstimulated by the weight of the top gas permeable lens, so it transfers through the soft carrier lens, or that your lid tissue, depending how they fit together, your lid tissue blinking over two lenses may still be, feeling the moving edge of the top, could even be soft lens, but most often the top gas permeable lens can still be felt, all of which may produce that very vague dryness-like symptom when it may or may not actually be dryness of the eye. So there's the complexity, right? So certainly if you actually have dryness in your history, or have reason to believe that there are underlying causes of your dryness, you need to have that managed, and before your contact lens wear can be more comfortable, such as, and possibly utilizing special type of lenses like a scleral lens can be more actively help you with dryness of the eye, but without discussing refitting of the lenses, because you certainly could also consult your eye doctor or your contact lens specialist on that. But without that, let me give you some, I think, simpler approaches that you could at least try with your current gas permeable lenses. So number one, you could try a contact lens rewetting drop. Which you can find over the counter, but I find more effective if you use preservative-free artificial tear rather than contact lens rewetting drop. Those are tears that comes in single-use vial, not a bottle. And a recommendation that I typically make for my patients, without knowing what exactly lens material you're wearing, but a general recommendation that I make to my patients is to use preservative-free Refresh Mega 3 eye drop. You could use that over your piggyback lenses on your eyes every 2 to 4 hours. That may may lubricate both the surface of the soft lens and the top gas permeable lens, that may make your eyes feel better as your eyelids are blinking over the lenses. So that's one. Possibly also consult with your contact lens specialist if you want to stay in the piggyback lens system, to see if there may be a different lens material, whether the soft lens or the gas permeable lens especially if they can apply a coating technology like HydroPeg. Some materials are compatible with that. So choosing material carefully so that it's a material that's more biocompatible with your tear, and also a material hopefully that can be applied with this HydroPeg coating, which again we discussed in a prior episode if people want to take a look. That can make the lens more compatible with your tear film so that it tracks more tear molecule to coat the lenses. And therefore, it may also then reduce some of the dryness symptoms that you're experiencing with lens wear. And lastly, if you have been, as I said before, if you actually have dry eye condition, that you, especially if the symptoms exist when you're not wearing your piggyback lenses, that tells you that it's not simply related to the lenses or maybe indirectly caused by the lenses, right? Because you still have the symptoms without wearing the lenses. Then if that's the case, and especially if you know you've been diagnosed with dry eye condition beforehand, then it is very likely that you should follow my above recommendations that we've talked about, as well as seeking your eye doctor's help in managing the underlying dry causes. Because if you have better tear film dynamic on your eyes before you put contact lenses onto each eye, such as your piggyback lens system, then that your piggyback lenses will feel more comfortable and will also perform better for you during wear. Taylor, do you think that's clear? Do you feel like there are other aspects that maybe Denise was looking for that we need to further address?
I think you covered it. Regarding, I know you said the re-wetting drops are over the counter. What about the preservative-free drops?
Yes, the preservative-free artificial tears are also over the counter.
Perfect. That's very accessible, and I think you covered it. I think it's a good point that if she has this problem even in other lens modalities prior to this or without the lenses at all, that it's probably a deeper issue that she should talk to her doctor, and there's tons of different products and resources out there to try to manage it.
Absolutely.
Okay, well, our final question is from Dottie from South Carolina, and she says, I have had keratoconus for over 20 years. I wear scleral lenses and they have been giving me issues for a while now. My contacts get a film on them and I have a lot of discharge coming from my eyes. I have to clean my lenses several times a day. Any tips?
Sure. Hi, Dottie. So it's like you read my mind when I was answering Denise's question, because the reason that I say at the end that the contact lenses that one's wearing may perform better when the design and the material are both more compatible with the tear film of the wearer. One of the scenarios that I was referring to, meaning how do you get better performance? One of the scenarios that I was referring to is exactly what you're saying and what you've been experiencing. And so among many other treatment options that can be tried, here are a few things to consider, and I'm going to list them as much as I can in the order that I think you should try them. So the first three that I'm going to list can be tried in conjunction with each other. So number one, replace your scleral lenses if it's been a while since you've got a new lens or new lenses, pending if you're wearing the you did actually say both eyes. So if you have, if it's been a while since you've gotten a new set of lenses, the performance of your lenses can decrease over time just from general wear and tear, and even if you have been taking good care of your lenses. And so, and certain things like HydroPeg technology, that coating technology, if you're not constantly enhancing it on a monthly basis, it can also wear off at some point. So things like that, when you get a new lens, if the lens material is able to have HydroPeg apply, then that's the reason why you have a boost in the performance of the lens. And I usually, for that reason, typically recommend my patients to replace their lenses every 1 to 2 years. And for patients who gets film like you are, I also recommend them to do a monthly treatment, which we'll talk about a little bit later. So number one, try to get new lenses if you haven't done that for a while. Number two, and that's even if your lenses currently feel comfortable after you clean them. That doesn't mean, because most people think that they have to wait for the lens to have some major crack or chip, or if the lenses are broken before they replace the lenses, and that really isn't the case if you want the best comfort and best performance. Number 2, use contact lens rewetting drops like I had advised Denise, but again, I find that preservative-free artificial tears every 2 to 4 hours on the eye, as I had mentioned before for Denise, I think that can relieve some of, possibly rinse away some of the deposition or the deposit on the surface of the lens. But I will tell you that I don't find this approach to generally, you know, reduce the film buildup significantly. It does help. I just don't think it's one of the most effective. So I still think that if you want to hold on to your current lenses that you're wearing, you should still do it, but know that this isn't likely the most effective approach. And that's why you do them in conjunction with, you know, getting new lenses, trying to do rewetting drops, especially with the preservative-free tier that I just mentioned. And number 3, in addition to the number 1 and 2, sometimes that debris accumulation, most people think that because they take the lens out, they're cleaning it, so it must be on the lens itself. They sometimes they're not aware that the deposit that they're seeing in their vision, right? Because your vision gets hazy. Some of the deposit actually could be debris suspension underneath the scleral lens, not necessarily always on top. And most people get both, right? So while taking the lens off, cleaning it may be helpful, you're also at the same time removing the debris underneath the lens by filling in with new solution. So number 3, I find that if you use a more viscous preservative-free tier, like a refreshed Celluvisc, again, you can find that over the counter, to partially fill up your scleral lens, and then you could, most people use a preservative-free saline solution to fill up the entire scleral lens. I find it to be helpful if you use that refreshed Celluvisc. You could start with half a vial all the way up to 1 vial, and then top it off with your preservative-free saline solution. It would generally increase the density or viscosity of the fluid underneath the lens, making it much harder for debris to get trapped underneath. And at the same time, because you're diluting it down a little bit with your regular preservative-free saline, it's also not too thick to block you from seeing through the lens. So I find that combination to be very helpful, and if you do that in conjunction with the first 3. Number 4, if you try 1 to 3, and you find that the symptoms actually do not dissipate with the new lens, and you try to and together with 2 and 3, then you should inquire about your eye doctor whether or not your scleral lens material are available in something that will be more biocompatible with your tier, because that also means that it will be more resistant to debris deposition. And like I said, I prefer using a material that could have an added treatment technology called HydroPeg, because I find that it further repels deposit better and maintain the visual performance throughout the day for my patients. And for those who actually still gets a little bit of the slight deposit on the surface of the lens, I want them to keep up to make sure that they have the best effect from the HydroPeg. So there is a monthly treatment kit that you could obtain from the manufacturer of the HydroPeg, and it's called Tangible Boost. You could do that once a month for 30 minutes soak. It enhances the coating effect. So I will previously have talked about this in a different episode, so again, look that up. So that's number 4. I find that to be very helpful. And then if that is making it nearly perfect for you, but maybe you still want to make sure that the lens is more comfortable or that it performs a little bit better because there's still just a tiny bit left, maybe down to, say 20% of what you previously experienced. I also find one little trick of soaking your new scleral lens in a solution that you could get over the counter, a contact lens saline solution called BioTrue. It's not preservative free, so it's not to be used to fill up your lens, but I find that it either make the lens a little bit more well coated or a little bit more moisturized on the surface. Again, it resists a small amount of deposit depositions throughout the day. So I have my page. This is not to replace your disinfection. You still need to clean your lenses, disinfect it however you are doing currently in the morning. I mean at night, and then in the morning when you're ready to put your lens on, just dump out the disinfecting solution you have in the case, and then rinse it off with your BioTrue so that it's so that the lens is clean, and you put BioTrue solution in the case, put your lens in, soak it for 20-30 minutes or longer if you have more time to wait in the morning. 30 minutes in the morning for most people are doable. And majority of my patients said that yes, they do feel more comfortable, and they feel like the deposit comes much later for them when they do that. And then lastly, as similarly to what I said at the outset of this question, and also for Denise, which is if you have been diagnosed with dry eye condition, then it is very likely that you have to do everything that I've said. Again, everything's small and simple, but you may need to do all that, as well as consulting with your contact lens specialist in managing the underlying dry causes to get the best performance of these lenses that you rely on for your vision.
Excellent, excellent tips. And just to add to that, you mentioned cleaning routines, and I'm going to link a couple articles from our website just as a reminder of how to properly care for your lenses. Sometimes we just need a little reminder, and a lot of people also don't know that you need to replace your contact lens case. And so sometimes you're cleaning your lenses properly, but then you're putting them in a dirty case that's older. So it really counteracts everything you just did for your lenses. So small things like that might make a big difference too.
Absolutely. Yeah, and I also will provide Taylor, I will provide you a link to back to the very first question from Jose about the post cross-linking recovery period. When I refer to the general trend, I actually there are several peer-reviewed publications that all echo the same thing, but I personally also have written a peer-reviewed publication on that, stemming from the pre-FDA study. So I'm going to give you the link so people can look up the abstract themselves to if they want to learn more about what to expect after cross-linking.
Perfect, great. So yes, everyone can look in the description box below, and those articles will be there for you. And I'll also try to link that past episode that you mentioned about the different types of contact lens modalities if anyone is interested as well. Well, thank you, Dr. Chang, for guiding us through these very good questions, and thank you to everyone for writing in. And next month, look for another Chang Reaction episode with answers to more questions about all things keratoconus. And if anyone listening has a question that they would like answered in a future episode, you can go to the NKCF website, and under the For Patients tab, you'll see a drop-down menu and click Ask the Expert Chang Reaction, and here you can submit your question. And finally, NKCF operates with the support of friends and donors, so if you feel the urge to support us, you can make a much appreciated online gift to the UCI Foundation. In closing, I just want to thank you again, Dr. Chang, for always helping us out, answering our questions, and I wish everyone happy holidays, stay safe, and we'll see you in 2023.
Yes, I can't believe it's the end of 2022. Thank you for spending a whole productive year with us, to our listeners. So happy year end, Merry Christmas, happy holidays. Have a great 2022, and we'll see you back in 2023, as Taylor said. Continue to send your questions. Thank you.